Hello. Today we're talking about a new system developed by Carolon for the treatment of venous stasis ulcers, related venous edema, and edema also formed by other etiologies as well, period. The Carolon sleeve wrap comes in a box as shown here. There is a sizing chart on the side of the box, so it's easily selected for the appropriate size. And the box will contain three major components, two major components and a third secondary component. The two major components, the first one of which is a sleeve. As shown here, it's bagged and easily removed with the perforations. The next component is the wrap. Most of the compression is all through the wrap itself. The sleeve only has 5 millimeters of compression, so all of the compression therapeutically applied is through one layer of the wrap. And then the third component are these velcro strips used to keep the sleeve wrap in place. In the box, you'll also find a little pamphlet, a sizing chart, and it will also have a very simple diagrammatic representation with photographs and description of how to apply the sleeve wrap. The first component, of course, is the sleeve. It has a very nice soft terry cloth liner, but it can be used reversibly as well because the outer side may be thought to be softer for those with very friable skin conditions, especially those dealing with end stage of life skin changes and people with similar problems. It is reversible, and you can see we're applying it simply by pulling it over the front of the foot, and the bottom of the heel is then situated in the heel cup. It's important that the heel is situated properly to make sure the garment is properly placed on the lower limb. It's then placed proximally to the tibial tuberosity, just below the popliteal space. And then distally, it's important to make sure the sleeve extends to the metatarsal heads. There should be no creases and should lie very smoothly on the limb. The elastic wrap is designed to work with the program. It's scored with lines to help you develop a 50% overlap going up the leg, as we'll show you in a moment. And you simply stretch it out maximally to 100%, bring it back 50%, and that's the level of compression to apply to the limb. You'll see there is a minor color change as you stretch this and bring it back, and the color tone will remain as you go and wrap the wrap on the limb. First, secure the wrap to the forefoot, being certain to allow the sleeve to extend beyond the wrap 1/4 to 1/2 inch. After it's secured around the forefoot, you then run it in back of the heel. And you can see as we do this that if you apply the appropriate traction to 50%, it will contour nicely around the heel without any dog ears, so there's no areas of increased pressure on the skin. Come around the top of the ankle, the bottom of the heel to secure the bottom of the foot around the heel, and then the back of the heel and the ankle to secure the back of the heel. You simply then, using the lines shown in the wrap, use a 50% method and apply the wrap proximally up the limb to end at the area just below the popliteal space, below the tibial tuberosity. You'll want to leave about 1 inch of sleeve to extend beyond the proximal wrap near the knee. After it's applied to full length, you then cut any remaining wrap material. You do not want to wrap extra material around the limb proximally, because each time you wrap one layer, you increase the compression to the limb. And that can cause a tourniquet effect and therefore cause problems that would be harmful to the patient. So simply cut the extra material, and then this wrap is secured simply with these velcro strips that were designed specifically for this wrap material. They will not slip and keep the wrap in place. You can then fold back the proximal edge of the sleeve so you have a nice smooth finish and a nice smooth edge, and that's the system. It's simply applied and very fast. Some practitioners may want to use the velcro strips around the ankle. I like to use them, but other providers don't. It's really a matter of choice depending on how your patients respond. There are 3 strips, 2 which are designed to go around the back of the ankle and back of the malleoli to the bottom of the midfoot. And you can see here in this example that when the doctor first applied it, there was a slight error. So he then cut the remaining velcro. But it's really better if the velcro plantarly extends into the non-weight bearing area of the arch. Also, you can see here that if you apply a posterior strip, that the strip can go distally enough underneath the heel. So realizing this, the physician will readjust the velcro strips, which can easily be done with this system. Other systems are not adjustable, but this can be. The excess velcro is now removed. The velcro strips now end appropriately in the midfoot under the arch. And the posterior strip is applied to the back of the leg, lower leg, back to the heel, underneath the heel, and ending in the midfoot in the non-weight bearing area of the arch. It's important to make sure that the proximal aspects of all velcro strips run at least 1 inch above the heel counter of the shoe. And again, it's best if they end distally in the non-weight bearing area of the midfoot. The wrap can be easily removed by simply unwrapping it, and it has the benefit that if it's the physician's choice or the provider's choice, it can be reapplied to the patient after the dressing is changed. Thank you. We hope you all try our sleeve wrap system. You'll find it quick and easy to apply and giving guaranteed compression that's graduated from the distal aspect of the limb to the tibial tuberosity. Thank you and have a good day.